the patient is 52-year-old man. Is he a man or female? Okay, he's a man. So he has intermittent chest pain. Okay, it typically lasts 5 minutes, not more than 10 minutes. Pain radius to left arm and jaw. This is, clearly I can say this is stable angina. He has LDL cholesterol, so he's having atherosclerosis and stress ST segment depression. Okay, so clearly he has a stable angina, right? He is not having myocardial infarction because ST depression, right? So he was given a medication to treat his symptoms. He was not given a medication to treat the pathology. Just the symptoms. Symptoms are what? Pain. What do you give to relieve the pain of, the stable angina patient? Nitroglycerin or glycerol trinitrate, whatever. NO basically, right? So what's the what's the mechanism of action of nitrates? You should know what's the prime drug. You guys, you can't expect me to teach you all the drugs right now. I'm a physiology teacher, not a pharmacology teacher. But you should know what's the first line drug. So to relieve the symptoms, whenever this line says relieve his symptoms, we always give nitroglycerin to treat the symptoms. And to treat the pathology, we give anti-atherogenic drugs like atorvastatin, aspirin, clopidogrel, etc. Right? Those are the treatment, but symptomatic treatment we give nitroglycerin. Vasodilation of what? Vasodilation of what? Arteries, vein, arterioles, venules, what? Capillaries, what? Veins, right? So there is venodilation. Basically, there is pooling of blood in the peripheral circulation when there occurs venodilation. That is the main mechanism. Never say that this decreases myocardial oxygen demand, like NO. If you think of venodilation, you can also think of coronary arteries, right? So that will, if NO used to increase the diameter of coronary arteries, then oxygen would reach enough to this. But that doesn't happen because NO is a venodilator. Hydrolyzin is an arteriodilatator. That can surely affect coronary arteries, but not NO. Make sure, okay, this is a very commonly tested topic. So when there is a pooling of blood, there will be decrease in venous return. Agreed? So which of the following curves shows decreased venous return? Curve 4. As simple as that.
Thanks for watching. Please give a thumbs up and subscribe for more.